As the number of COVID-19 cases increases across the state, spikes are being felt as well in Florida nursing homes and assisted living facilities.
Our Contact 5 investigator Katie LaGrone with what this means to your loved one and your ability to continue seeing them face to face.
8 months after the country shut down to stop the spread of COVID-19, the virus isn't going away. COVID-19 cases once again reaching record numbers in the Sunshine State, striking cities, communities, and Florida's long-term care centers.
Are you guys concerned about this increase?
You know, we are concerned, especially over the holidays.
Since November 5th, the number of positive cases involving residents and staff at nursing homes and assisted living facilities is up. Last week, the state reported over 1,300 new cases involving residents, a 6-week high, with those living in long-term care centers still accounting for 40% of COVID deaths statewide. During a recent call,
we are starting to see the numbers trend up.
Florida's boss of long-term care centers focused on the bright side.
We are still at less than 1% of long-term care residents being COVID positive, so that is a plus.
But facilities are growing concerned.
Everybody just has their guard up.
2.5 months ago, the governor lifted visitation restrictions. The industry isn't aware of any plans to go back.
There hasn't been a global discussion about any changes to visitation.
Locking down centers would reignite concerns about staff morale and resident mental health.
They need interaction. They need the human touch. They need to be able to connect and reconnect with their families.
In Arizona and San Diego, where COVID cases are also on the rise, some nursing homes have ceased visitation.
We will never do any of these lockdowns again.
But Florida's governor has been clear about his unwillingness to shut down the state again. If that includes long-term care facilities remains unclear. Staff and resident testing, along with visitor screening protocols, haven't changed.
It's still the wrong kind of testing.
Brian Lee, executive director of the nonprofit Families for Better Care, has been advocating the same message for months.
What needs to still happen is the testing at the door. There has to be on-site testing, molecular rapid testing at the door.
Meantime, facilities are banking on early vaccine success as a sign of things to come.
We hope the vaccine's out by then.
Because time for long-term care residents is critical. Katie LaGrone, WPTV News Channel 5.
Families and the public also being asked to continue doing what we've all been doing, or at least most of us, many of us. Wear your mask, adhere to social distancing rules, and any gatherings should be small and outdoors.